So first we're going to go through a sequence that looks at a way that you can mobilize the tissue around the hamstring. Now, some people are very sensitive in certain spots, specifically right where the hamstring comes up to attach to the back of your pelvis, which is this bony prominence that you sit on that you'll feel. So if any of these are too sensitive, you're going to move down away from the most sensitive area, and then gradually over time you may see that you can get closer and closer to that source without pain. A good way to start is going to be a tennis ball, which is a little bit softer. But typically, once you get used to the tennis ball, something more firm, like a lacrosse ball or something like this that's the size of the softball, will be more of an advantage to use. You just want to make sure you're not trying to torture yourself with this movement. It's something that should feel a little uncomfortable, but you shouldn't feel like you're really putting a ton of pressure. So I'm going to start off with the tennis ball, and I'm going to sit at the edge of something that's pretty firm. So even this table is a little softer. Sitting at the edge of a coffee table or a harder chair, or even sitting on the floor would be an okay position to do this. But it's better if you have a way that your leg can hang off the edge. So even sitting on like a high bar stool or something like that. And I'm going to take this ball, and if my pain is up towards the base of my hip, I'm going to come down just a little. I'm going to put my leg on top of this ball, and I'm just going to very lightly kick. So I'm just moving my hamstring in and out of a lengthened position, nothing to where I'm really stretching it aggressively, but I'm moving it while there's that pinpointed pressure. And you'll find some different spots that may be tender, and like we said, if the spot's too tender, or if you really feel like it's hurting you to do this, typically if you move a little further down, that's going to be more comfortable. But all of these are meant to be a little bit uncomfortable. The big question I always ask people is it getting worse as you do it? And when you stop doing it, do you feel any worse? As long as the answer is no, that's all right. This is meant to push on tissue that is sensitive. So, you do want to start with something that puts some pressure on it. If it's too much, if you feel like it's really irritating, then either back off to a lower spot, or maybe even start with something softer. Maybe roll up a towel to start this, or cover the ball in a towel. But something like this, and like I said, for more pressure, you would go to something even a little bigger. And you would go, I would say just off of where that painful spot is, going through this kicking motion. Very lightly. At the end of the kick, I do flex my foot a little bit, but I don't hold, I just fluidly move. And then I would start working down the length of my hamstring. If it is very painful and sensitive, rather than starting up at the source, I may start further away. I may go down closer to my knee and say, okay, that doesn't feel too bad, and then gradually work up closer, trying to get maybe 10 to 15 kicks at each position.